This video looks at what the recent hype is about dry eye disease and its importance. We all know that a healthy ocular surface is a prerequisite component of good vision. We have all had a patient who has 20 by 20 vision but is unhappy, especially those of us doing premium IOL practice and refractive practice. With the new generation using so much of smartphones, dry eye disease is here and it's here to stay. The DED report says that the prevalence of dry eyes is between 5 to 50% and as high as 75% based on signs alone, and a much higher prevalence in Asians. DED triages the disease and looks at patients who are asymptomatic but may have signs of ocular disease. This is the arm of patient which needs to be picked up prior to surgery, because treating this will ensure that you have a happy patient after surgery. It also looks at patients who are symptomatic but there are no signs, and this is another arm of patients which may be in a preclinical stage of dry eye disease and again needs to be treated before surgery. While patient symptoms are recorded, it's important to use a questionnaire to quantify the disease, and this may be given to the patient at every follow-up so that it's not only diagnostic but also helps in prognosticating the disease. While clinical signs like tear breakup time, fluorescein staining, and Schirmer's are still the gold standard, and dry eye is essentially a clinical diagnosis in obvious cases like Sjogren's syndrome, post-LASIK dry eye, post-trigeminal ablation, or post-scleral buckle. However, there are diagnostic dilemmas when there is a discrepancy between the signs as well as the symptoms. That's the arm of the patient where the patient may be symptomatic but you may not be seeing signs. That's where the role of the newer diagnostic machines come in. Mebography helps in acquisition of images and evaluating the meibomian glands using infrared light. Either the gland dropout or whether there's inflammation of the gland and causing edema may show reduced number of glands as seen by mebography. Looking at lipid layer analysis, this test looks at the color scale and helps us differentiate between a normal lipid layer versus an abnormal lipid layer. This is a report given at the end of the test. Non-invasive tear breakup time is also important in giving an objective evaluation of the ocular surface. Tear meniscus height calculation, as done, is also very important to know whether the diagnosis of dry eye. Recording the tear meniscus at each visit also helps in prognosis of dry eye disease. This is how the printed final report looks like. Moving on to pathophysiology, whenever there is a desiccating and osmotic stress on the corneal surface, there is increase in cytokines and MMPs on the ocular surface. And this can be now picked up by measuring the MMP levels directly from the tear film. The only caveat being that this is positive only if the MMPs are more than 40 nanograms per ml. Tear osmolarity measurement also helps in diagnosis of dry eye. Moving on to the therapy of dry eye disease, the severity of dry eye disease determines the treatment of dry eye disease. If there is staining on the corneal surface and inflammatory signs have been picked up either clinically or on the diagnostic test, then definitely there is a role of anti-inflammatory drops. Lubricants with high hyaluronic acid would be used in cases with staining on the corneal surface. If inflammatory signs are seen, then there is a role of punctal occlusion and biological tear substitutes as well. Punctal plaques can be either temporary or permanent and can be either occluding only the punctum or intracanalicula. Biological tear substitutes have a definite role in chronic dry eyes, patients with Sjogren's, patients with neurotrophic ulcers who are not responding to routine conventional treatment. Patients with neurotrophic pain also respond well with biological tear substitutes. Patients with Stevens-Johnson syndrome may also need adjuvant measures like using scleral contact lenses. Intense pulse light is the latest treatment for meibomian gland disease, which helps in treating the blocked meibomian gland. Hence, to summarize, newer diagnostics offer an objective evaluation of the ocular surface and help to evaluate prognostics as well. Addressing dry eye disease issues prior to surgery increases the patient's postoperative outcomes and satisfaction.